Okay, so I'm going to hit really briefly on something that I remember struggling with myself as a nursing student. I remember my teacher using some of these words here that I have written down: depolarization, contraction, systole, or repolarization, relaxation, and diastole, kind of interchangeably. And I remember being confused, like, why do you keep talking about the same point in time, but you're using these same terms or these different terms? Or I'll see a practice question and they'll say like atrial contraction, where in another practice question they'll say during atrial depolarization, but they're kind of talking about the same thing. So I remember being confused myself, and so I figured I'd write this down and show you how I kind of make my way through these terms, and hopefully that'll help you understand why they use them interchangeably for the most part. So the term depolarization or the term repolarization, I want you to think of electricity when you hear that. So electricity. Those are electricity terms for the most part. So I like to use the analogy of, if you go over to your wall or wherever you're at and you flip the light switch on, that allows the electrical current to travel up to the light bulb, fiddle through those little filaments, then the electricity lights up the light bulb because those filaments have electricity running through them. So I use that analogy because if you have a heart muscle, you have to first depolarize that muscle. So think of the light switch allowing the electrical current to go. Think of that SA node as your light switch, and then the electrical current flowing through the pattern of the atrium and then the ventricles to where the electricity flows through that, it depolarizes and allows then the muscle to contract. Just like the light switch allows the electrical current to turn the light bulb on, the depolarization of the muscle allows it to contract. So that electricity is what makes the muscle contract. What you're looking at on an EKG is electricity. So you're looking at the electrical pattern that's occurring in the heart at any given point in time. So think of depolarization or repolarization as electrical terms. So when I depolarize, it helps the muscle contract. When I repolarize, it lets it relax. So think of depolarization, repolarization is electricity. Think of contraction and relaxation as the muscle actually moving. So muscle movement. For contraction and relaxation. So if I depolarize the atria, it causes the atria to contract. If I contract something, I'm squeezing it. So contraction is muscle squeezing. When I squeeze something, the pressure goes up. Like if I had a hard-boiled egg in my hand and I squeeze that egg, what's gonna happen to that hard-boiled egg? It's gonna come all up out of my hand, right? Because I just squeezed it, the pressure went higher in my hand, and now the egg's coming out of my hand. If I squeeze and I contract the ventricle, what's gonna happen to the blood in it? It's gonna go out to where it needs to go. So depolarization is the electrical term, the electricity that allows the heart to contract. When the heart contracts, the pressure goes up. That's why they use those terms interchangeably. I could say during the P wave, what occurs, I could say atrial depolarization. I could say atrial contraction or atrial systole. It's all happening during the P wave because the heart beats like this. Right? The atrium contract, then the ventricles contract, then the ventricles relax. So every time that this happens is a P wave, right? The atrium contract, you're going to see a P wave. Then when the ventricles contract, you're going to see the QRS. So P, QRS, T. P, QRS, T. So on this side here, the green words, repolarization, I like to think of as turning the light switch off, allows it to, like, the electrical system to recharge itself. When you turn the electrical system off, it allows the muscle to relax. That's why you have relaxation. And then diastole is a low pressure. So when I relax my hand, the pressure goes lower in my hand. So hopefully that helps. Hopefully that helps you kind of understand those terms a little bit differently. You might see in different NCLEX practice questions those terms used interchangeably for lots of different reasons. If you just understand that they all kind of happen at the same time, they're just, one's talking about electricity, one's talking about muscle movement, either squeezing or relaxing. And then when you squeeze or relax something, the pressure changes. And if you're having a hard time remembering diastole and systole, just this quick reminder, when you do a regular blood pressure, let's say normal blood pressure is 120/80, what do they call the top number? Versus what do they call the bottom number? Systole, systolic, high pressure, right? Diastolic. The higher pressure, the lower pressure, the bigger number, the smaller number. High pressure, low pressure. High pressure, low pressure. See you guys later. Bye.